Welcome back to Midday. We're visiting now with Manshadi. Welcome.
Thank you very much, Katie.
Of course, Manshadi Pharmacy, 2 locations here in Kamloops.
Thank you.
It's always nice to visit with you, and you always have great topics to discuss, things that people might not be aware of.
Yes.
What are we talking about today?
Today, we are going to talk about stress and anxiety. Some individuals during this festive season and the holidays, they go through quite a bit of stress, anxiety, sometimes depression. So we want to give them some coping mechanism today and what they can do.
And it's so important that we talk about that, because I know we talk about peace and joy and happiness and all of those things, but the flip side is there are a lot of people who suffer from stress and anxiety during this time.
Correct. It's more than just the fear or being anxious. Anxiety can really disturb daily activities of individuals, and they can't even move sometimes.
Yeah, it can be very crippling.
Very crippling, correct.
And especially when you're being told you should be happy and you should feel cheerful.
That's correct.
It doesn't work that way.
Not always.
Yes. Okay. So there are several types of anxiety. We do have a slide here as well to take a look at.
Yeah, there are general anxiety disorder. Probably you have heard some people have OCDs, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and social phobia, which some people have. And those are some of the types of anxieties that we see.
Okay. And if people suspect that they're experiencing these things, and again, to a degree that's really affecting their lives and is changing what they're capable of doing, what should they do?
Well, there is, I really like this concept of, it's called Bounce Back Program, and it's done through the mental health. So please look at bounceback.ca. It's a guiding self-help program, which works through the cognitive behavioral therapy, and it changed the way people, they look at their stress, their anxiety, or depression, and how they can cope with it and they get better. So please look into that. I brought, they have video, they have workbooks, they have worksheets, so that's very good.
Okay.
There are other things, obviously, people can do. They should seek a physician early on.
Yes, I was just about to talk.
Yeah, don't wait too long.
Don't Google it.
Yeah, no, and
go
don't.
to a healthcare professional.
Correct. Don't diagnose yourself. Aerobic exercise, I find it is awesome, especially swimming. You breathe deeply. Meditation, and for some people, prayers works great. Talk to people, eat healthy so you don't gain or lose weight. Sometimes we use alcohol or drugs to cope. Please avoid that. Avoid isolation. Talk to someone, and those
are easy fallbacks. I mean, when you don't feel like being with other people, when you don't feel like being social, but it does dig that hole deeper.
Absolutely. So seek out a trusted friend would be great. There are some other things. We were talking to Rocky, and I was mentioning that when you give back to the community, when you do an act of service, you feel good about yourself. So do that. It's good. And we are also like the concept of breathing, inhale and exhale deeply and slowly, and laugh. It produces dopamine, which is a good neurotransmitter to make a person happy. So these are some of the coping mechanisms that we will suggest, and get out there and enjoy yourself and accept things that you can not control, and things that you can control, maybe make some changes.
Right, absolutely. So if people seek out medical help and they do find that there's a medication that their physician recommends, you guys are a great place to come and to find out more about that medication as well.
Please come and see us. This research shows the combination of cognitive therapy, behavioral therapy, and medication works the best.
Right, so not just medicating.
Not just medication, and that's a problem. Some people, they only look at the medication because it's a quick way of just taking a pill and move on. But if they really want to deal with someone's anxiety and depression, they need to dig deep and find out what is the root and causes of the problems
The whole
are.
picture. And the flip side is also not thinking you can just do exercise or just get involved in community.
Correct.
That sometimes medication is needed too, and that's not a failure.
It's not a failure. It can be 1 year, it can be 2 years, and it's a bridge to get better. Absolutely.
Oh, I like that. Yeah, a bridge to healing.
Yeah.
Absolutely, a two-part. If people do need advice and would like to know more about this, or have seen a physician and have questions about the medications, because sometimes it's not that comprehensive through your physician, pharmacists know what they're talking about.
Please seek out for a trusted pharmacist that they are not too busy. Go and seek out and see if you can do a talk with them, if there's any recommendation in terms of over-the-counter medications, vitamin D, omega-3 fatty acids. There's some of this stuff that they have the research proven that is effective. It's it's evidence-based medicine. It's not just And
sometimes those things won't come to you through your GP, but a pharmacist can tell you more and have better recommendations. And for drug interactions.
Correct.
Sometimes those are important things too that a pharmacist knows about.
Yeah, pharmacists, they go to school for 6-7 years to learn just about drugs. And physician, they go to school to learn about diagnosis. So they are both have a place to deal with different situations.
These things all function best when they work hand in hand.
Yes.
Great. Where can people find you?
We have a location in downtown Kamloops, and we have a location in North Shore Kamloops, and we are happy to serve people.
Great. Thank you so much for joining us today and for these great tips. And talking about this stuff is so important, and it's how we help people. So thanks so much.
Thank you, Katie.
And Merry Christmas.
Merry Christmas to you.
We'll be back with more Midday in just a moment.